some of the scenarios where maxillary sinus perforations may happen. Of course, during teeth extractions. The second type would be doing a sinus lift bone augmentation. And also when we manage dental implants, whether we place them or whether in some cases where we remove them. In all these cases, when we're dealing with the posterior maxilla sinus perforations, something that we have to consider and plan for. Now, before we start about the treatment management, I think it's really important to highlight and emphasize the importance of imaging for diagnosis and planning. I think that CBCT is an absolute requirement prior to almost any treatment that we do nowadays, but especially in the posterior maxilla. Managing the extraction sites with a sinus perforation, there are primarily two techniques that I commonly use. The first one is what I call a 3-layer site graft, and the second, a 1-layer site graft. Let's take a look at the 3-layer site graft. This essentially involves placement of a collagen or ethylocollagen plug at the site of the perforation, apically at the sinus, and then placement of my bone graft material, whether it's allogenic bone or autogenous bone or xenogenic bone, and then layering it on the ridge with another collagen or ethylocollagen plug. The 1-layer site graft is primarily using one material, either a collagen or what I'm going to show you more closely in this presentation is use of ethylocollagen plug, where we just use one material to graft the site. Now, what is the goal of the therapy? In a 3-layer site graft, my goal is primarily to repair as well as augment. So as we can see in this example, in a patient that has a defect on a buccal aspect and also a sinus perforation, using this 3-layer technique helps us to not only repair or prevent the fistula from persisting, but also augmenting the defect at the same time. What if I have a case as is such where the tooth is a 5-wall defect and simply my goal is to do repair and preserve, then a 1-layer site graft will certainly work quite well. Certainly during the sinus lift bone augmentation, one of the key aspects of the success in sinus lift bone grafting is to preserve the integrity of the Schneiderian membrane, the sinus membrane. So if there is any perforations, can compromise the outcome and the survival of the bone graft that's placed. If we look at the different classifications of sinus perforations, there are basically 5 classes. There's class 1 perforation, which typically is about less than 2 millimeters. Class 2, 2 to 5 millimeters. In class 3 perforation, there's a complete tear of the sinus membrane. In class 4 and 5, of course, we have more significant breakdown of not only the soft tissue, the membrane, but also the bone, and those become more advanced levels.